Tom, thank you very much for joining us today and agreeing to the interview. And congratulations, firstly, on your role as the Chief Data and Analytics Officer for the HSE. So to kick off, maybe you tell us a little bit about your background and what led you to this job here with us today.
Thanks, Joyce. I suppose firstly I'd like to say I'm really excited about the appointment as the Chief Data Analytics Officer in the HSE. It's the first appointment of such a role in the HSE, and I think it's a key, I suppose it's a key marker and indication of the value the organisation is placing on data now as well. How did I arrive here, I suppose, is the question really. I started working in the HSE in 2001. Prior to that, I did a degree course in applied computing back in the day, but it was the start of my journey on IT. I went working in the UK then for a software company, and I started working then across various different industries across Europe and in the UK. A lot of them were centred around the banking and the healthcare, pharmaceutical environment, but a key focus was on data, how we were using data, collecting data, designing systems to collect data. Started in the HSE, as I said, in 2001. It was a really exciting journey for me in the context. I had the opportunity of working with so many different teams, so many different projects, even at the early stages of some messaging exchanging between GPs and ourselves, and the point where people didn't realise that actually, you know, moving away from printed paper and output, where we were trying to convince everyone that it's okay to send a digital copy of your lab results and test results. We've moved along so much from there now that it's great. So it's presenting loads of opportunities. Worked on many different projects in the HSE on data. Took on responsibility for the IIS team a couple of years ago. The IIS team have been delivering out on some of the analytics and bringing data together. They were involved in a lot of the pandemic work in terms of presenting data back out to the public. So it's an exciting opportunity for me. I know it's a big role. There's a lot of responsibility, but I'm looking forward to the opportunity.
Tom, what excites you most about leading the HSE's data and analytics strategy at this pivotal time?
I see it as a real opportunity, Joyce, to make a real difference in the context of how we deliver our services. Data is such a key enabler for more efficient, safer, better patient outcomes across the HSE. What really excites me as well is that the engagement I've had in the couple of months since I've been in the role. I've met so many different people. There's a real positivity in the context of the role and the difference it can actually make. People are enthusiastic. They can see the value and the benefit here. And with that, I think it presents us with an opportunity to capture that momentum and keep driving forward. So it's an exciting time, and we have a real opportunity here to move forward in a positive way.
How does your role, or the role as CDAO, align with the goals of Digital for Care 2030?
Well, Joyce, Digital for Care 2030 sets out, I suppose, a clear vision for what the future should actually look like in the context of digital technology and how we use data. Data is one of the core principles of the Digital for Care. Data-driven services provides us with a real opportunity to underpin data across all of the foundational elements, all of the digital solutions we're going to deploy, and more so how we focus on integrating that information so we can aim to provide better, safer patient outcomes. We can provide patients with more access to their own information, because that's what they want to do. We all want to see our own information. We all want to be able to have the confidence that it's been recorded, stored and used appropriately. We want to be able to integrate that information across the various different systems we actually have. We want to be able to provide, I suppose, a coherent view to our service providers. There's a number of various different initiatives that are underway that are underpinned by the need to have high quality data available across the system. So I think it's a fundamental principle. It's a core requirement that nearly runs across all of the Digital for Care 2030, and it's one that needs to focus on the attention. It's one that my role as Chief Data Analytics Officer I've really got to focus in on, and we'll use it as a key focus and objective as we move forward.
Digital for Care 2030 prioritises integrated patient-centred care. How does a strong data infrastructure enable this?
So I suppose access to the right data in the right place at the right time is key. We know a lot of our data is held on paper records. We know we need to move to an environment and a landscape where we can integrate all that information. The long-term vision here is to implement an electronic healthcare record. So the business case for that's being developed. So that's an exciting time. That's where we'll be able to create an electronic health record for every individual. That'll cover the complete care pathway for the organisation. That will take time and investment. We're also looking at implementing a shared care record. We'll be able to create a summary record of a patient's data and make it available at the key points of care. So that's core. The infrastructure and the technology, and I suppose the awareness from our providers and patients that we need to collect quality data, we need to be able to identify individuals as we go through, and then put the underlying infrastructure in place to support that.
Tom, how can improved data and analytics help healthcare professionals make better, faster and more informed decisions?
We all need access and better access to information. We have various different tools available at the moment now that's presenting information and analysis of information. Everybody wants to have more access to that information. Everybody wants to focus on the analytics. We need to do more in that space to present that information in a better way. Partly, we probably don't fully understand what the organisation actually want to see. We know that we have real constraints and real demand on our services that require us to present that information in a better way. We need to understand and drive better insights from that data. That data obviously needs to be available, in some cases in near real time, or at least integrated across quite a number of different systems. So a lot of work in progress has been made in that area. There's a lot more, there's an increased requirement now and a drive across the regions and the areas, both inside the organisation and the outside of the organisation, to have greater visibility on our data and to analyse that data and drive insights from that data. So we're partly on that journey, but we have a long way to go to actually really reap the benefits and drive the vision through on that.
What role does real-time data play in patient care, around resource allocation and service delivery?
So I suppose, Joyce, real-time data is available to clinicians at the point of care. So we know they rely on real-time data. But if you look at it in the context of information, how we deliver the service on a wider scale, we need to be able to provide real-time data on the activity and the operations that are ongoing within the hospital. It gives us visibility on upcoming trends, on where potentially we have bottlenecks in the actual service, or where we need to take remedial action fairly quickly to resolve scenarios that would potentially impact on patient care or the delivery of that patient care. So that real-time delivery is really important. Our clinicians and our service users want to be able to see that and be able to visualise that. They want to be able to see and identify patterns and trends as they happen. Real-time data also, it should help to keep patients out of acute settings as well. The more visibility we have of real-time data will help us in that space.
Tom, could you perhaps maybe share an example with us where data has already played a transformative role in Irish healthcare?
So we have an integrated information services team that has been focusing on the collection and integration of data from a number of different systems over the last number of years. It started out of the COVID pandemic, where there was some really good work done in presenting information out. There was a real drive from the public there in trying to want to be able to get access to more information, more visibility. We all had a real keen interest in numbers, and we wanted more insights in the context of data. We developed that service over the last number of years. We've now integrated more information from many different systems. We've also now, in February time, released the first version of the HSE app. It's a real step forward in how we're using and integrating information from different systems and providing that back out to the patient. So we as patients and the public now have a secure means of accessing our own personal health information. At the moment, there's vaccination, COVID, flu information on there. For maternity patients, their appointment is there. And we have a plan this year to provide more information widely across the appointments that you would have with the HSE, but also more information pertinent to you as we move forward. That's a real example of where we're taking information from many different systems and presenting it securely and safely back out to the public. We can also use that information that we've collected to provide it out to those that want to analyse it, want to get greater insights in the context of the actual data that's there, but also be in a position where we can provide it, given the proper governance structures and controls in place, out for various research purposes and for secondary use of that information, where we can get real value from linking that information up with wider population health data to, I suppose, support better patient outcomes as we move forward. So it's really having a real impact now as we move forward, and I think we just need to build on that now over the coming years.
Tom, what are the biggest challenges you're facing in improving data accessibility, integration and interoperability across the HSE?
The biggest challenge is that we have so many pockets of information located around the organisation. We also know we have an environment where we still collect a lot of information on paper. And if it's not collected on paper, it's collected on a system using a tool or a product that isn't integrated or linked to anything else. In some cases, we may not even be fully aware of what information is being collected or how it's being collected. There's a lot of really good examples where it's been done really well, and we've rolled out some really good solutions and technology over the last number of years, and we'll continue to build on that. And they're core because they put the foundation elements in place where we focus on standards and the quality of data. We focus on ensuring we collect data in a standard way, using a standard procedure and process. So we all understand what the same data item is and what it actually means. So we all have the same understanding of what something might actually mean. So that's a real challenge. If we look at trying to identify, so our own records, if we have a care pathway where we're involved with various different service providers, we would expect we'd expect the HSE as service providers to be able to link our data. And I suppose that's a challenge we actually have. At the moment, we're now rolling out and collecting the PPSN number at point of care. That's just another tool in enabling us to identify and create and link each individual back to an individual health identifier. So that's one of the tools and bits that will allow us, as we roll out and devolve more solutions, digital solutions, it'll allow us to be able to link and integrate that data. So that's, I think, one of the core foundational elements of how we might be able to address one of the biggest challenges that's currently out there.
What steps, Tom, are the HSE taking to ensure trust, security and governance in healthcare data use?
We know trust, security and governance in healthcare data use is really important. It's really important to us within the HSE, to our clinicians, service providers, but it's also a real requirement from a public perspective and the patients. So they rely on us to ensure we keep their data secure and govern it properly. We know, we'll all remember back in 2021 where we had a significant cyber issue which impacted on the security of patients' data, our data as well. So that was a time and a period we hopefully never want to repeat again. So we've been implementing a number of different procedures and processes to enhance our security, and we're really taking that very seriously as an organisation. And we'll continue to do that over the coming years. We're also looking at how we govern the data. So we want to ensure we use the data, we record the data in a proper way. We want to make sure we keep it, I suppose, ensure we have quality data in place and we're using it for the appropriate purpose. We also want you to have, and the public to have, confidence in the data we record. We'll continue to manage and implement tighter governance processes as we go forward, and they're continually reviewed. And I suppose it happens across all the organisation. It's not just for managers or clinicians. Everyone across the health service has a responsibility when it comes to data governance, and we have training programs in place to make our staff and service users aware of that. We'll continue to reinforce that message and those training programs and that mindset as we move forward. We would hope that that is going to provide enough trust and confidence for our patients and service users in the context of the data and how we use it.
Tom, artificial intelligence and machine learning. So AI and machine learning, also falls under your remit as CDAO. And we know globally AI and machine learning are transforming healthcare. So what potential do you see for these technologies within the HSE?
It's a really exciting time in the context of the health service and how we provide health and where artificial intelligence actually fits in. The HSE are recognising that. As you said, AI falls underneath the remit of the CDAO. We're moving ahead and trying to take advantage of all the opportunities that are presenting itself, being very mindful that the EU AI Act is now in place. We've recently established the AI and Automation Centre of Excellence. We've set up an AI implementation working group. A key deliverable from that working group is the creation of an AI strategy, which is going to set out the future vision and where we see ourselves over the next 5 years in the context of use of AI. We're also developing out an actual framework which is going to detail and outline how we govern the implementation of AI. So it's a really exciting time, but we also need to make sure we put the necessary guardrails in place, that we use AI safely in an ethical manner. Because even from a trust perspective, from our own staff and our own teams and the public, they all want to be fully aware and informed and have a trust in that we're using AI in a safe and ethical way. There's no doubt there's no doubt there are certain pockets of the organisation that are already using AI. It's not a new technology. I will have covered AI when I did my course back a number of years ago, and that's a number of years ago, but it has changed so quickly over the last number of years. It's likely in 6 months' time there'll be a new technology that's come on board. We have vendors now presenting us with opportunities. We know it's a well-developed product and tool set used in radiology. We know it's used in other elements and pockets of the organisation, but it's now been brought underneath the EU AI Act and regulation that's coming into force. It's a really exciting opportunity. The strategy and the framework, which is due for completion by the middle of this year, will give us the direction we need to head in. We'll identify some of the early initiatives and opportunities we want to take advantage of. And it will also put in place, I suppose, the governance process and the framework that will allow us to implement it and control it in a safe and ethical way.
Tom, you mentioned a strategy and framework, and you mentioned, that'll be ready mid-year this year. Maybe tell us a little bit more about that, or even who are the players involved in putting that together?
So Joyce, we recognised that there was a real need to have a large stakeholder involvement and input into the framework and the strategy, because it impacts on so many parts of the organisation and also on our service users and patients. We have a representation across our clinical community, our management community across all the regions, technology inputting in. We have input from our data protection office in the context of how we're going to govern and manage data. We have input from our HR department, because we're very aware that artificial intelligence can create an element of anxiety across the organisation, and also for our patients and service users. We have representation from IPOSI and the Patient Advocacy Group, because there's a real need to get a perspective from a patient perspective. The IPOSI jurors report on AI was published earlier in the year, and that gives us a real good insight into some of the concerns that are actually out there, and some of the considerations that we need to take into account, and which we are. We're also linking in with Health Tech Ireland. So earlier in the year there was an MOU signed with Health Tech Ireland to increase our collaboration with them. They're such a core part of this AI journey with us, and we need to work with them and bring them with us and get their input and views as we move forward. HICWA are another key partner involved in the development of the actual framework. They're responsible for the delivery out of a framework governing the safe and ethical use of AI, and they already have a program of work in place to get that completed later this year. So we're really mindful of the trust we need to build in the use of AI, both within the organisation. We need to be able to create and generate, I suppose, a level of confidence, both inside and outside, that we're going to approach, take advantage, because there's opportunities here for AI that if we don't take the opportunities, we have a risk of not delivering patient care and the best patient outcomes moving forward. Underpinning all of AI is data. So good quality data that we can rely on that will provide and create a better outcome from the use of AI across the health service.
Tom, Digital for Care 2030 emphasises collaboration. How do you plan to engage with clinicians, IT teams and policymakers generally to embed a data-driven culture?
Joyce, it's really important to collaborate and engage across the entire organisation, clinicians, IT teams, in the context of data and how we're going to use data. We currently have a programme of work and a key deliverable from my perspective at CDAO to deliver a data strategy and an associated data management plan. I have a target date for the middle of the year for that to be completed. Part of the creation of that data strategy is a significant stakeholder engagement across the organisation. We've started that engagement now. There's a number of meetings have already taken place. We're involving clinicians, service users, patient reps. We're engaging the Department of Health, HICWA, Health Research Board, Health Tech Ireland, various different parts of internal to the organisation but also external. We're mindful that there are challenges out there in the context of how we use data, how we link and integrate our data. The challenges I've already mentioned in the context that we have silos and pockets of data out there that just aren't integrated. So having that engagement with the wider service users, both internally and externally, is key to try and understand the problems they're having and how we can approach them. I need to get a view of their vision in the context of where we're going with, where they want to go with data and what a realistic plan actually looks like from their perspective. This, I suppose, also needs to be driven from the ground up, and clinicians are at the coalface of delivering patient care. So it's a significant culture change in the context of how we look at data and how we manage data and approach data, and that's something we'll need to address as we move forward.
Tom, what role do you see data literacy play in ensuring healthcare professionals can make the best use of analytics tools?
Data literacy is really important. It's so important that everyone is able to read data, is able to understand the data, is able to drive insights from the actual data. We know we have a huge amount of data across the organisation, but we know we don't use that data well enough. We don't use the data to drive insights. We don't really have enough focus on data-driven decision making. We have a number of programs of work underway, and there's a training program being developed around data literacy and how we can bring people through the journey of understanding and appreciating the value of data and how they can use that data, how they can derive greater insights from that data. And I suppose how we can develop a sense of curiosity around data, in the sense, because curious minds in terms of looking at data, often the best opportunity to identify something that we weren't ordinarily aware of. So that's a culture change too within the organisation, and we need to provide the tools and the training to bring people on that journey with us.
So, Tom, you're a couple of months into the role, so looking ahead, what are you hoping to achieve in your first year as CDAO?
Well, the development of a data strategy and a data implementation plan and the implementation of that is a key deliverable. So that's something that I'm committed for delivery on. The target is for the middle of this year, and we're still going to try and keep to work to that. We discussed AI in the context of a strategy implementation framework. It's such a fast-moving technology and environment, we really need to be in the space where we've identified the journey that we're going to take, and some of the early initiatives we can actually start implementing. So that's key. But it's also around establishing the office itself and developing out the actual team, creating the links in with the REOs and their teams. I suppose trying to understand how we can better deliver using the health data we actually have. There's some foundational pieces we need to put in place. I need to work closely with the clinicians and the service users and create that collaboration, I suppose, across the teams. So if I look back over 12 months being in the CDAO role, I suppose I'd like to think it's the start of a journey. It's the start of how we transform the way we use data, build on the momentum that we already have there, on the really good foundational work that's been put in place. Establish real good links with the regions, the clinicians, our service users, our external partners, and look to the future and the value that we can actually drive across the organisation.
Finally, Tom, have you any thoughts on how staff, patients and the various stakeholders can support the HSE's data transformation journey?
I suppose it's important for staff and our patients to realise and understand why we're collecting this data and information. It takes time and effort to record the information. I suppose I'd like our staff and our teams to realise that there's real value in collecting this information. We're collecting it, to ensure we can deliver better and safer patient care. It has a real benefit when we want to link that information with other information we have in a different system. So we create an integrated view of a patient record across all the care pathways. So that takes time and effort when data has been entered in. It also takes a level of diligence to make sure we record that in the right manner, in a standard way, so we can interpret and use that in the same consistent way moving forward. So that's important, and we would appreciate as much support as we can across the organisation with that information and the collection during and with the collection of that information. From a patient perspective as well, when you turn up at a patient setting, at an acute setting, when we ask for your PPSN number and we ask for various information to identify you, it's to ensure we can link that record across the entire care pathway. So there's real value in there. We have a purpose for collecting that information. And I'm hoping then as we move forward, both the patients and yourselves will get a greater understanding of why we're collecting this data and the real value in collecting it and using it across the organisation.